I'm Dr. Lynn Carlson. I want to talk a little bit about pain because there are different types of pain. The first being nociceptive pain, which is probably what most people think of when they think of pain. This is when there's actually something injuring our body. It's stimulating the nociceptors in the periphery that are telling the brain, ouch, something's happening. And we need to be able to respond and pull away and withdraw from that injurious thing. So that's a good thing to happen, to have nociception, so we know what's going on that's injuring our tissues. Second type of pain is related to the healing process of inflammation. So it's an inflammatory mediated pain. When the healing process is happening, there is inflammation, but it's that swelling and the chemical changes that can also activate those pain fibers to signal pain. But the third type of pain is what I want to speak to, and that's called neuropathic pain. This is where chronic pain falls in. Chronic pain is when there's no obvious acute injury happening. It's been healed. There's nothing obviously damaging to the tissues, but yet the person is still perceiving pain. In neuropathic pain, there's literally been changes within the spinal cord and the brain, both chemically and physical changes that signal differently. So your brain is perceiving pain to things that normally shouldn't be perceived as painful. For example, if you've had an old shoulder injury, it's been healed, but now when you move your shoulder, movement of the shoulder shouldn't normally be painful, but now your brain is perceiving that as pain. That's a chronic pain syndrome. So these neuropathic pain has to be treated differently than we would treat an acute pain. And this is where the functional neurological approach comes in. We need to find out what the mechanism was of the original injury, what's perpetuating that within that person's nervous system, and what we can do to get in there and start retraining the brain so there's a different perception to that pain. So if you are suffering from neuropathic or chronic pain, the best approach is to get in there and functionally look at some systems that need to be worked on so we can recalibrate your brain's perception to pain.